Some things can be put on hold during this time, but some things can't, like certain medical questions. Thankfully, physicians are developing ways to help you even while you're at home.
Even though we're spending most of the time at our house, things happen, life goes on. And whether it's you waking up in the morning with a rash, or maybe your child's acne becomes a situation that needs to be handled, right? Things happen, and we have help for you. Now, Dr. Jorge Garcia is joining us now. Good to see you, sir. And you are the founder of Apex Dermatology. Welcome, welcome.
Thank you for having me today.
Yeah, so now you are considered an essential business, and that means that you're open. Is that right?
Yeah, so our Apex, we are still open. We have 7 locations across Northeast Ohio, and we are open for urgent appointments and emergencies, and also for skin cancer surgeries that are important. But we are now seeing a lot of our patients through teledermatology, which is really the new buzzword now in medicine. It's very convenient, and it's a way of you connecting, keeping engaged, connecting with your doctor, but from the convenience from your own home.
So how does it work, the telemedicine? That's so interesting, and it's just fascinating.
Yeah, it's very similar to what we're doing now. You basically, if you're a patient, you have a skin rash, or you have a lesion of concern, or something that you have a follow-up appointment, like for acne, you log into our portal. We give you instructions, and we give you some links. You click on it. You can do it from your phone also, and then you have a conversation with your doctor, like we're doing here. And in dermatology, is a very visual field, so we can see a lot of things, ask you some questions, and sometimes we can make a diagnosis or recommendations over the phone. But there are some times that we need to see you in the office for something further that needs a biopsy or further treatment. So it's important for that. Telemedicine is really the first initial contact, and then after that we can decide whether we need to see you right away or we can wait, especially during the pandemic.
There are some cases where people do need to come in to see you, and how does that work?
Yeah, at Apex, we have established special protocols for the pandemic. We are now checking patients' temperatures before they come into the office. We have a set of guidelines and screen questionnaire that we do to make sure to keep our staff safe. We're also checking our staff temperature, and we're following the 6-foot rule, where we don't really have people in the waiting room. We have people in the rooms. We try to encourage people not really to bring anybody with them to the visit, so that the people are by themselves or maybe with one person. But really trying to keep it really safe, so that the patient understands that it's safe to come to the doctor's office to our doctor's office still. It's safer probably going to our office than to going to the grocery store to pick up milk or something. So we want to create a safe environment so the patient understands, hey, we can still see you. Yep.
And plus, you've made medical personnel on the front lines aware that you are taking care of these cases, and you're able to focus. So they're able to focus rather on the pandemic.
Yeah, that's really the most important part here, is that we are doing our part. We're out there helping all the providers. As doctors, we've got to do our part. And we have connected with our local emergency rooms, the local primary care doctors, to make sure that they know that we're open to see any skin type problem. For example, we had a patient that had shingles, and she was going to go to the ER. Well, you know what? Those are patients that we can see in our office, and then they don't have to go to the ER and get exposed to the virus, or let those doctors focus on people that are real sick, and we can take care of all that stuff, lacerations, any type of drainage of abscesses or drug reactions. We can do a lot of stuff for that in the dermatology outpatient center, and to still keep it safe. And that's our way of helping the community. At Apex, we're all about community involvement, and our mission is transforming lives through healthy skin. Well, this is the perfect example for this. We're really aligning with the communities and doing our part.
You truly are, and it's amazing to see how you're adapting and still coming around us and protecting us, and also helping those on the front line. So we appreciate everything that you're doing. And for everybody at home, you can reach out to apexskin.com and get all of the information there, and see if you need to come in for an appointment, or if doctor can treat you right on the computer. It's amazing.
Yeah, take a look at our website, give us a call, don't be shy, and we'd love to see you.
Okay, thank you so much.
Okay.
Have a great day.
Thank you.
This segment of It's About You was sponsored by Apex Dermatology.